Have you watched the movie Front of the Class? The movie was based on the true story of Brad Cohen, a young man who was diagnosed with Tourette's syndrome, a type of tic disorders. Brad has developed uncontrollable tics since a young age, often making sudden noises and movements in class. Because of his tics, he had a hard time being a student and he was often laughed at by classmates or even teachers. As Brad grew up, he wanted to be a teacher. He used his knowledge and kindness to convince the school, his colleagues, and students that him, despite the tics, can be a good teacher. Through Brad's story, we can have a brief idea of tic disorders, which contains Tourette's syndrome. But what exactly are they? Tic disorder is a series of neurological disorders that involve tics, which can be sudden and repeated twitches, movements, and/or sounds. People who have tics cannot stop their body from doing these things, just like we can't stop ourselves from coughing or sneezing. For example, a person with a motor tic might keep blinking over and over, or a person with a vocal tic might make a grunting sound involuntarily at a high frequency. These symptoms are just like what it was shown in the movie. According to 2020 demographic data, about 1.4 million people in the U.S. are affected by tic disorders. Despite the large number of patients, tic disorders have no cure so far. However, eliminating triggers have been shown to be effective in controlling symptoms. We will introduce different triggers and ways to control them later on in our videos, so make sure to follow our account and stay undated. Tics are far more common among children and teens than among adults. Most patients start developing symptoms during childhood. While some of these young patients get rid of tic disorders naturally when they enter adulthood, some don't. About 80% to 90% of people who have tic disorders have other coexisting conditions such as attention deficit hyperactivity disorder, ADHD, obsessive-compulsive disorder, OCD, and anxiety. Tic disorders can be classified as three types. Tourette syndrome, TS, sometimes called Tourette disorder. Persistent, sometimes called chronic, motor, or vocal tic disorder. Provisional tic disorder. They each have different characteristics. Note that below is the criteria in shortened form. They are presented for your information only and should not be used for self-diagnosis. If you are concerned about any of the symptoms listed, you should consult a trained healthcare provider with experience in diagnosing and treating tic disorders. Tourette syndrome patients will exhibit both motor and vocal tics, lasting for at least 1 year. People with persistent motor or vocal tic disorders have either motor or vocal tics, lasting for at least 1 year. People with provisional tic disorders can have motor or vocal tics, or both, but have had their symptoms less than 1 year. Proper treatments to tic disorders and controlling of triggers can improve all aspects of patients' lives, from achievement and careers to relationships, family life, self-esteem, and personal goals, not to mention physical well-being.